Low potassium levels in the body, also known as hypokalemia, can lead to a range of symptoms. Some of the common signs and symptoms of low potassium levels in the body include muscle weakness. Low potassium levels can cause weakness and fatigue in the muscles, especially in the legs. Cramping. Potassium is important for muscle function, and low levels can lead to cramping in the muscles, especially in the legs and feet. Irregular heartbeat. Potassium plays a critical role in the electrical signaling that controls the heartbeat, so low levels can cause an irregular or even a rapid heartbeat. Constipation. Low potassium levels can slow down the movement of the digestive tract, leading to constipation. Tingling or numbness. Low potassium levels can cause a tingling or numb sensation in the fingers, toes, and other parts of the body. Fatigue. Low potassium levels can cause fatigue and a general feeling of weakness. Mood changes. Some people may experience mood changes, such as depression, when their potassium levels are low. It is important to note that these symptoms can be caused by other factors as well, so it is important to speak with a healthcare provider if you are experiencing any of these symptoms. Diet for low potassium. If you have been diagnosed with low potassium levels, also known as hypokalemia, your healthcare provider may recommend changes to your diet to help increase your potassium intake. Here are some dietary tips for increasing potassium levels. Eat more potassium-rich foods. Some of the best sources of potassium include bananas, sweet potatoes, spinach, avocados, white beans, salmon, and yogurt. Choose low-sodium foods. Sodium and potassium levels in the body are closely linked, so it is important to choose low-sodium foods to help maintain healthy potassium levels. Avoid high-sugar foods. High sugar intake can lead to potassium loss, so it is important to limit your intake of sugary foods and drinks. Consider potassium supplements. Your healthcare provider may recommend potassium supplements to help increase your potassium levels. Some examples of high potassium fruits and vegetables include tomatoes, oranges, cantaloupe, kiwi, prunes, raisins, dates, apricots, mushrooms, and leafy greens like kale and spinach. Choose lean protein sources. Some protein sources, such as red meat, can be high in sodium and low in potassium. Instead, choose lean protein sources such as chicken, fish, and tofu, which are generally lower in sodium and higher in potassium. Drink coconut water. Coconut water is a natural source of potassium and can be a good option for those with low potassium levels. It is also low in sodium and high in other nutrients like magnesium. Monitor your medication use. Some medications, such as diuretics and laxatives, can lead to potassium loss. It is important to note that if you have severe hypokalemia, you may need medical treatment in addition to dietary changes. Always consult with your healthcare provider before making any major dietary changes.